one of the biggest questions from the webinar is acquiring new patients. How do I do it? This is a massive subject, which you talk about in probably 50 videos, but try to sum it up in a couple minutes.
I'll give it a shot. Okay, I'm gonna tell you this. We could spend 50 hours on this subject and you would then be in a spot where we could really have a great conversation. But to jumpstart things right now, whatever you think is the correct amount of outgoing communication from your practice, I can tell you, you're probably underestimating by 10 times, if not far, far greater. So you say, well, no, we do a postcard. No, we do a Google post every day or two. We place ads on Google and we have created 5 testimonials, all very good, all very good. And I want to acknowledge you on the fact that you've done those things. I can tell you the amount of noise hitting your patients right now, commercially and other. Let's take a look at what's happening in the environment, in society, and what's on the news, what's going on, what about their personal life. They are being hit with lots of demands and messages that far exceed what you are sending to them. Now you might say, well, yeah, but their dentist isn't going to be the most impinging message and point of focus of this person. I understand what you're saying, but I do want you to think with this. You are in healthcare. You're not in retail. That comes with an oath that you took to help people out. And I'm not making this like make you feel bad thing. I just want you to think with this. We know that if somebody comes in for a cleaning, exam, and x-ray, they just want your new patient special, or they're just coming in for their 6-month check and it's been a couple years, maybe they missed it out and COVID got confusing and all that. And they open their mouth and you find that they've been heavily grinding and they need 4 crowns and a night guard. What's the reaction going to be of that person? That person is probably going to be shocked, no, denial, I don't think so, it doesn't hurt, I don't know. This is probably what's going to come. And you know this. So on a scale of 1 to 10, how important is that treatment plan? What do you think, Amy?
Like 3.
Yeah, 3. I think that's gratuitous. It depends on the patient, but some might say, well, that's important. I trust you, doctor, and I think that's great. I think you're probably right, Amy. Probably about a 3. Yet, hey, it's time to get their new phone. Got to upgrade to their new phone. On a scale of 1 to 10, what do you say, Amy? Average consumer?
9.
9. Some people say 10. Hey, it's time to plan that anniversary vacation. It's coming up. It's coming up. Scale of 1 to 10, Amy?
10.
10. People have different priorities. Yours is to take a look at the fact that that's our public. They are great people. They're often very clever, very smart, very intelligent, very accomplished in their respective fields and in life, wherever they engage. When it comes to healthcare, not so much. They start their day with, a big sugary drink. They top off the morning with a package of Oreos or whatever. Unfortunately, that is where we sit. Healthcare and taking care of oneself sometimes drops down here in priorities. The cool, new, shiny stuff comes up here. Your job is to promote your cause and promote your purpose, which is to remove decay, infection, and problems from people's mouths so that they live longer and healthier lives. Independent studies show that people with healthy teeth and gums live, on average, 7 to 10 years longer than people who have unhealthy teeth and gums. Conversely, people who have outstanding bacteria and decay in situations in their mouth, gum disease, etc. What have we found? Well, not us, not you and I, but these independent studies have found links to heart disease, diabetes, premature birth defects. They found links to dementia, right? Alzheimer's, studies have found this now. Stroke, the list is long, and I've just named a few. So I want you to get your team oriented and kind of pepped up every day, understanding the importance of what it is you do. You extend people's lives and you take them out of an unnecessary predisposition to a whole host of systemic conditions, serious systemic conditions. That's your purpose. Now communicate it. Educate people about it. Get lots of messages out about that. Hey, we missed you. Do what, one of our most successful campaigns, a digital reactivation campaign. Get messages out to everybody who's overdue by 8 months or more in bulk, repetitive messages that are very personalized, but, tap them on the shoulder routinely. Emails out about it too. Do videos about education. Get them to understand what can happen on a missing tooth. What is drifting? That tooth that's gone, what can happen here? And now the mouth is out of alignment. And now when they bite down, things don't go so well. And now they get a cramp in their head. Cramp in your leg is called a Charlie horse. Cramp in your head is called a headache. Right, so you've got outstanding bacteria decay in your mouth, you might find yourself even more susceptible to the common cold and flu, and they found links to COVID, of course. And so all this could make the person more exhausted. Talk to people about these things. Make your message known. It's not, hi, come on in, we'd love to help you. We want to make sure you're smiling. Okay, you can get that stuff out there too, but talk to your patient base and your prospective patient base about these things. Carry that message from the heart. Do so routinely, more regularly than you could imagine, and just watch what happens. And I say that, and I can talk into details, and we can go into details, but I just wanted you to get the basic message. I hope that helps.